Hello, Angela Westover here, MN 590 student with Purdue Global University. This presentation is to serve as a virtual clinical assignment based off the Unit 6 course assignment. So we'll discuss the common gaps found after completing a gap analysis for my evidence-based practice project on nurse workstation ergonomics. Here you see listed some of the common gaps that I've identified in completing the gap analysis. This includes gaps in the population, initiatives, support and resources, and education. I'll go into each of these separately throughout the following slides. In reviewing the literature, a gap in the population was identified. Very few studies were concentrated on nurses in the hospital settings, which is the target audience of my evidence-based practice project. So, although some of the studies did include nurses to some capacity, several of them also included or concentrated only on non-clinical hospital workers, office workers, laboratory technicians, and/or community outreach nurses. Another gap that was identified related to the various initiatives. Many of them were not focused specifically on improving computer workstation ergonomics. Although it is relevant to computer use but not directly related, several of the ergonomic initiatives also focused on environmental factors such as sound, lighting, temperature, and other surrounding conditions. Some of the ergonomic programs included other initiatives not specific to computer ergonomics, such as pre-work stretching or incorporating training on restraining and calming emotionally unstable patients. Many ergonomic initiatives were focused on other nursing tasks outside of computer use, such as patient movement and transfers, dealing with hazardous material, and other common nursing tasks that create awkward positions. Availability of support and resources was a very common gap in much of the literature reviewed. This considered having outdated or inadequate equipment, such that it is not able to be adjusted to various users, and/or the existence of outdated, inadequate workstation design, like high counter space or inconveniently placed components. It also considered whether or not professional consultations such as physiotherapists or occupational therapy practitioners were available, the lack of managerial support at the immediate or higher levels, and the absence of any existing policies which would mandate ergonomics education initiatives. The biggest and most significant gap was related to ergonomic education programs. Much of the literature provided that it was completely absent. If it was available, it was often lacking to some capacity. Existing ergonomics education programs were found to be limited in their delivery, such as not including various methods and modalities like PowerPoint, videos, hands-on participation, handouts, checklists, as well as other resources or opportunities to enhance the learning experience. There's concern that existing programs are ineffective as they're not interactive or engaging enough for the participant, and they do not provoke true behavior changes. Some of the methods used to identify and implement best practices for my projects include having the education focus specifically on computer workstations, making this ergonomic training a mandatory requirement for the hospital nurses, including a pre and a post test, as well as a trans-theoretical model survey, having a teaching plan that has many components, having multimodality educational delivery, and applying this to each individual. The test and survey will help to determine the participant's knowledge and stage of learning, as well as if there was any new knowledge gained and a progression in their behavior change. A three-part teaching plan will help to emphasize various components of computer workstation ergonomic education with intent to not just increase the user's knowledge, but also to provide them with necessary information that will serve as a foundation for behavior change. Many modalities will be used to enhance the learning experience, including interactive learning videos, handouts, and checklists. With individual application, the participant will have to take ownership of their experience by assessing their own environment and determining how to appropriately incorporate ergonomic principles into their own computer workstation use.